Ok, portanto, sigo a intervenção em língua portuguesa para dar aqui passo desculpa, vou continuar a intervenção em inglês. O nosso próximo orador é Dipak Karla. Next speaker in the closing session is Dipak Karla in representation of Hertz Pon, who was the original scheduled to director of IHD to address farewell remarks, but fortunately the president of the IHD, Dipak Karla, is recovering from his intervention yesterday. It's amazing to have him here in the closing session. Dipak, welcome to the closing session, and the floor is all yours.
Well, thank you very much, Paul. So I would like to again apologize. As you said, I had an operation yesterday, so I couldn't travel to be with you, and I'm very sorry about that. Our institute, and in case you haven't picked this up, is a multi-stakeholder organization. Our role is to help champion for all stakeholders the best possible health data and getting the best out of health data. Data quality is a kind of holy grail that is often spoken about, complained about, but not often actioned on. And yet, right across Europe, we have picked out all sorts of experts with different levels of detail, different backgrounds. And it's been a real pleasure to bring all of these different data quality champions of their own flavor into one environment. For me, putting together this conference program over many months, including many people I've known for years and said, come to this event. My agenda was not only that people in the audience should learn a little bit about data quality from random people, but that these people also, these European and world experts, would be exposed to each other, because sometimes they are working in their own corner of the data issue, like an AI developer or a patient or a hospital manager. So one of the real agendas I had for this meeting was to get all of these speakers to hear from each other and learn from each other and realize the most important messages of all, which is that data quality is no longer something we can dream about. It's no longer something we can talk about and complain about. It's something we have to address. And addressing doesn't just mean measuring, it means improving data quality, helping to get better data for Europe so we can all benefit from it in the many, many ways we've been hearing for 2 days. But the most important message, nobody can do it alone. No stakeholder can do it alone. No organization can do it alone. Saying to a health ministry, it's your problem, saying to the European Commission, it's your problem, is a mistake. It will only be helped if we work together, understand each other, respect each other's perspectives, and collaborate and share. And that is really the spirit I've picked up. Today, I've been able to listen remotely all day. Yesterday, I couldn't attend anything. I was in hospital, missing you all. But I picked up from today and messages I got from colleagues yesterday that the multi-stakeholder spirit was really strong, that people were learning about each other's perspectives. And so my wish hopefully has come true, that we now have a stronger community in Europe, realizing with a bigger perspective than before, how to work together and to build our data up to a standard where we can really use it well, improve health, improve care, accelerate research, innovate, and be creative. So I feel very excited for that. Paul, thank you for your side of the equation, looking after the practical dimension of this conference, getting it all running. And also my colleagues, especially Ricardo and his team at the University of Porto, who have also been strong scientific collaborators in helping to fill the program with great speakers. So I'm grateful to everybody, but I'm also really positive about the multi-stakeholder community building that's taken place for 2 days. And I hope we can cement that through a declaration on health data quality, the Porto declaration that I hope we can agree to over the winter period.
Fantastic.
So thank you very
Thank
much.
you so much. A round of applause here for Dipak. And
Thank
I
you.
think Porto will be indebted to this declaration. I'm sure it will be very, very, very.
And we will be indebted to Porto.
Okay, thank you so much.
Thank you.
Thank you so much. Okay, so next in the round of interventions, Ricardo, Jardim, Gonçalves, full professor and director at UNINOVA, and optional for Portuguese on English because we have simultaneous translation, Ricardo.
I think I can go for English, could be easier, I think, for all. So good afternoon. First of all, I would like to welcome the participants, Mr. Secretary of Health of Madeira, I see you present, Mr. Representative from Mrs. Representative of the European Parliament, dear colleagues, organizers. So it's really an honor to be here in this event as the premier sponsor for the forum. It's really very special and particular considering that indeed in this moment data and especially the quality of data in what respects to health is really crucial. We have been during the last decades collecting and managing huge amount of data, but still today there are very important problems that we need to address. And here clearly we saw during these 2 days many regulations, strategies, methodologies, examples of cases where the data is crucial, but where the problems that we need still to address and face are clearly identified. One of them is for sure the problematic of the interoperability between the different formats of the data, the semantic issues that are behind that also conflicts with what we wish to have in terms of quality. And for me, as a representative of UNINOVA, that is the Institute for the Development of New Technologies, that is leader in Europe, and of course also in Portugal, addressing the digital transformation in digital health, with many projects ongoing, supported by the European Commission, is really very relevant to have the opportunity during these 2 days to also present what we are doing the best in terms of Europe. We brought here, not by chance, 4 projects that are real flagship projects supported by Europe, but with a strong connection in Portugal. All these projects that you saw here, you could saw outside in our demonstrators, are those that are fully implemented in Portugal and also are in use and can be experimented by the citizens. So we choose these projects, and then with the support of the Madeira government, we created the Madeira Digital Health and Wellbeing Initiative, where also the Portuguese citizens from the region can themselves take advantage for that. And also all the tourists visiting the region can also take advantage for that. For me, this is also a very relevant example of what can be done in terms to promote more and more what we are doing in the digital transformation, and also to make sensible the relevance of the data, not just technologies to collect the data, but also of the quality of the data. And this comes to my conclusion, where indeed these initiatives should be also the pillar for what was clear in this 2 days forum about the convergence of the strategies for the management and good use of the data, is to move the data for a citizen-centric approach, to have the data also fully accessed, especially the health data, from the citizens, and not just distributing from the different places where the data is collected. So this is my wrap-up, leaving a message of thank you for all the motivation and for the all encouragements and nice discussions that we had during these 2 days, and saying that I feel very proud to have the opportunity to be premier sponsor in such forum addressing so relevant aspect nowadays for the best of our society. So thank you very much.
Thank you so much, Francisco. Nuno Rocha Gonçalves, the floor is yours.
Thank you very much. Supondo que há tradução, sigo em português, se necessário. Não há problema.
Sim, pode seguir em português a tradução
Muito bem,
simultânea.
boa tarde a todos, obrigado. De facto, o maior apoio para iniciativas como esta é sobretudo dado pelos casos e pelas pessoas que entusiasticamente trabalham a área da ciência de dados, direta ou indiretamente todos os dias. Nós, ao longo de 2, 3 dias, vimos aqui casos fantásticos, absolutamente convincentes. Claro, quem estava nesta sala e quem nos assistiu à distância são sobretudo pessoas que já trabalham e não precisavam de ser convertidos às vantagens e ao interesse que os dados têm para as decisões em saúde. Ainda assim, haverá entre nós alguns que estão a explorar pelas primeiras vezes a área. E para esses veio sobretudo um conjunto de casos práticos que nos mostrou que para desenhar percursos clínicos eram importantes os dados, que para fazermos, por razões de otimização das nossas próprias decisões, a medição de resultados ou a medição de custos, era preciso um trabalho na preparação dos dados. Falámos aqui de datasets, falámos aqui de tecnologias de exploração de dados, falámos aqui até de aspectos culturais ligados ao rigor dos registros, portanto essas condições garantidas todas à partida. Falámos também bastante de tecnologias de informação e de comunicação, elas não como um fim em si próprias, mas como sobretudo um apoio importante à circulação, à fusão, à exploração dos dados. Falámos também em formas de eventualmente chegar às pessoas em termos de assinalar as situações de bom desempenho e as situações de oportunidade de melhoria e não o fazemos com base em percepções, fazemos sobretudo com base em dados. Por isso os casos que aqui tivemos, e é com pessoal e particular satisfação que 2 deles vieram da Sanofi, a empresa que me cumpre hoje representar aqui neste encerramento, foi uma satisfação verificar que nós e os outros todos mostramos que por um lado já está a ser feito, por outro lado é possível. E portanto os principais mitos acerca da dificuldade, das legalidades, de todos os obstáculos que se possa supor à partida de um projeto destes, estive no passado envolvido em alguns e ouvi, creio, não todos, porque a lista é certamente enorme, mas bastantes argumentos de porque é que não se devia avançar, ainda assim avançámos na maioria desses casos, valeu a pena e ultrapassámos essas dificuldades. Portanto, os parabéns sobretudo aos participantes, ao terem mostrado que é possível, naturalmente também os meus cumprimentos pessoais e institucionais a todos os participantes, à Faculdade de Medicina da Universidade do Porto, aos demais organizadores, meus, da nossa diretora-geral e de toda a companhia que, ao estar aqui hoje, ao estar presente e ao apoiar a iniciativa, quis dizer, nós e a indústria farmacêutica também estamos interessados nos dados. Não para os usar de forma comercial diretamente, mas conscientes de uma coisa, que a melhoria que prometemos fazer na vida das pessoas, vamos fazê-la sobretudo através de um melhor conhecimento esse, que é sempre fundado em dados, melhor do que outro recurso qualquer. Muito obrigado a todos e boa sorte para a preparação das próximas edições.
Muito obrigada, muito obrigado. Muito obrigada. Okay. So, seguindo aqui a ordem de apresentações que está estabelecida, então eu daria agora a palavra à primeira intervenção keynote, que será da senhora eurodeputada Sara Cerdas. Perdão, peço desculpa, o vídeo do Licínio Kustra, Mano. Primeira intervenção em representação da diretora-geral Sandra Gallina, que não pode estar presente, e igualmente o Licínio também, por razões de natureza pessoal, familiar, não pode estar aqui connosco, como era o seu desejo. Ele estava previsto estar e participar aqui ativamente até ao final. Vamos ouvir a intervenção da direção da Comissão Europeia.
Good afternoon, Helvet. Congratulations to the organizers for the vivid and timely discussions, as well as for the diversity of perspectives brought.
Sorry, Paul, in case you can hear me, the streaming video is coming through with Licínio's.
for sharing your insights on how to accelerate health equality. While space and time seem to be the fabric of our observable universe, health equality seems to be the fabric of the European health space. And to build and deliver the European health space that European citizens are hoping for, we need to put together our best ideas. Let me share with you a story about hope. This is Mr. Mano. He passed away due to complications from Cushing disease. It took too long for an accurate diagnosis, and the damage was irreversible. This is Mr. Kustra. He very recently passed away due to pancreatic cancer. He survived the first 4 years, but the cancer returned in a brutal way. This is me, Mr. Kustra Mano. And while these are not hereditary diseases, I do fear for me and for my children. But I have hope. And my hope is that our children shall not die from the same diseases that took our parents away. That hope is now my mission. While this story is close to my heart, the terrible fact is that 1 in each 3 Europeans can share a similar story. Look at the people at your side, and you will see it. The European health data space can become the hope for the ones that may face a serious or life-threatening disease in the coming years. The hope for new preventive strategies, the hope for new or improved treatments, the hope for innovative medicines and medical devices. As scientists, engineers, policymakers, innovators, and health professionals, we all realize that transforming hope into life-saving solutions takes an incredible amount of energy and resilient commitment to something we believe in. At the European Commission, we believe that the European Health Data Space Regulation and the multi-annual funding instruments will become cornerstones for delivering on Europeans' hope. We believe that more forums like this are needed to engage and bring the most ingenious solutions to practice. We believe there's a lot of work ahead, and the European Commission is committed to be part of this workforce. We wish you all a safe journey back home. Enjoy the time with your families, and see you back at the office on Monday to continue building and delivering the European health data space that the Union citizens are hoping for.
Uma excelente intervenção de Licínio, Costa, Mano, e agora sim, sem mais demora, para não perdermos aqui o elan da nossa sessão, passaria a intervenção à senhora deputada doutora Sara Cerdas, que fará a intervenção em inglês.
Yes, indeed. Thank you very much. Thank you all colleagues from the panel, dear colleagues, dear participants watching on site and online. Dear organization, thank you very much for this invitation and the possibility to address a few words at the closing ceremony. Indeed, Licínio's video goes a bit toward the intervention I had planned for this panel, because indeed I am here to speak a bit about the European Health Data Space, which is a regulation that, as we speak, is being negotiated at the European Parliament as one of the co-legislators of the European Union. But going a bit behind, to introduce myself, I'm a medical doctor in the field of public health. I'm a researcher and also a policymaker, currently a policymaker at the European Union as a member of the European Parliament. And I'm used since my 12 years after graduation to get excited about the different information that high quality data can provide us, such as prevalence rates, incidence rates, prognosis, survival rates, but also about efficiency, DALYs, QALYs, you name it. Indeed, it is of the utmost importance that decisions are based on what the numbers say and what is the option that best leads to the common good. And with this conference and team, I would like to reflect a bit on what we are doing at the EU. And just to provide you a bit of a background why this European health data space is so important. At the moment, we have that in the European Union, meaning 27 member states, 450 million citizens, we are, when it comes to health data, we are not in complete dark. We are in a room where only a few places are lit, and often we have to pay attention to where the light is shining on and who's lighting it up. And wouldn't it be fantastic to actually have a clear image on our mind about the space where we are? And this is what we are currently working on to analyze, discuss, and negotiate this regulation that actually comes from the European Commission of the European health data space and to unlock the true potential of health data in the European Union. Very briefly, this regulation, or as I sometimes call it, this will be a revolution in the European health data space, completely change the paradigm for all citizens in the European Union across borders. Because for the first time, European citizens will have access to their health data through their mobile phone in their own hands. And for the first time, they will live feeling that their health data is theirs and theirs alone, and that does not belong to the companies that keep it and store it. Actually, and what will this mean in reality? This will mean that it will not matter when you go to a health professional office. It does not matter if your health provider is on the public or the private sector. It's on Porto or it's in Warsaw in Poland, because the health data will be interoperable across the different spheres. There won't be any technological barriers and there won't be borders. This is what we are working on. So this will mean what? That if a Belgian patient will be able to have an appointment in France, a Portuguese patient will be able to have a second opinion on an imaging exam by a radiologist in Germany, or a patient from Czech Republic can go to the emergency room in Sweden. This already happens. However, what this regulation will bring is that all these doctors seeing all these patients from different member states will actually have immediate access to their medical record in their own language, already translated. So as you can understand, I'm quite excited about this because the potential and possibilities are enormous. Our priority working on this is on having citizens at the center of care and improving accessibility to healthcare. And for this is of the utmost importance to fully comply with the existing regulations, and throughout the whole process, we will guarantee that the patient consent will be a constant. So furthermore, I spoke a bit about primary use of data. I would like to just unveil a bit about the secondary use of data. This regulation will open the door for research as it has never been opened before. And this will be a quite cherished treasure that is being talked about, because it will actually provide value to the high quality data access that this regulation will bring. This will impact the health field in different fronts and areas, such as development of new medical devices, to conclusions about the effectiveness of one screening method over the other, about the effectiveness of different drugs, and why not making better policy decisions that best meet the health needs of the population. So these will be decisions that save lives and improve life quality and well-being for all 450 million citizens in the European Union. So dear colleagues, with this, I finalize my intervention, and I would like to thank you for the work that you have developed in these 2 days, recognizing the importance to access high quality data and how it is essential for the functioning of what we are trying to build, which is a true European health union. As the second speaker here this afternoon in this panel stated, this is a road that nobody will make it alone and everyone can contribute. And this will indeed be a treasure where the most precious asset is people's health, people's lives, and the future of the European Union. Thank you very much again for your invitation, and I wish you all the best for the future editions.
Thank you very much. Thank you very much. Muito obrigada, senhora deputada. E agora passaria a palavra ao Dr. Pedro Ramos, secretário regional da Saúde e da Proteção Civil da Madeira.
Good afternoon, everyone. It's a real pleasure to be part of this forum. So thank you, Paulo and Isabel, for this invitation. I would like to start giving special greetings for the panel. Dean of Porto University, Professor Altamiro Pereira, Ricardo Gonçalves, Professor of UNINOVA, Francisco Gonçalves from Sanofi, Licínio Mano, representing Sandra, Gallina, Sara Cerdas, member of the European Parliament, and Stephen MacFeely, Director of Data and Analytics from the World Health Organization. I would like to start to saying that innovation, artificial intelligence, and virtual reality, augmented reality, extended reality, IoT, data center, robotization, telehealth will be the future in our society, but they are already the present. And in health, we will have a big and huge important role in assess, diagnose, treatment, rehabilitation, communication, humanization, metrology, dashboard, helping one of the most important things that we have in health system, healthcare, that is decision. We need to decide. Health will be a distance of a click. Madeira and this health system already started digital transformation since 1993, with the creation of our data system, and since then we improve all the capacities of this system, and recently we won the first place in the European contest between and among 19 countries. We received the first place in the international contest with our e-health interoperability data that is Atrium 6-run electronic health system 5 from Madeira. We will reach 20 years next year. We have resisted the new challenge. We have resisted till now 560,000 clinic processes identified, and then we have 57.4 million data from those files resisted that we are going to analyze now and see what we can improve in our health system. Since then, we developed not only the app for the patient, for the doctors, for the nurse, for the emergency department, for prescription, for connect with the hospital system, for pharmacy, and for visitors. Also, the citizen can be in contact with the hospital for consultations, exams, blood analysis, metrology, and their results. After the pandemic, we learned a lot. We learned that we need to change all the systems. Health will be digital health, with telehealth, with artificial intelligence and machine learning and data centers. Data will be the most powerful weapon that health system will have in the future. With data, we can improve our medical assistance. We can create dashboards helping the decision. We can create algorithms to support decision, and we will have more time for humanization in our clinical assistance. As I told you, Madeira already started this digital transformation. And recently, after the pandemic, we established several connections with the UNINOVA, Private Consulting, the Institute of New Technology, UNINOVA, the Future Hospital, a new partnership with the objective to create a technology hub, a new resilient ecosystem in the healthcare in Madeira. We are connected with several institutes and universities, several professors and students, enterprise, entrepreneurs, startups with the objective of investigation in 3 axes: improve healthcare work conditions, improve the degree of satisfaction of our patients, try to achieve and build new management of the health system to become with more efficiency and reduce loss and waste in the system. Next month, in December 2022, we will have the 3rd conference with the UNINOVA Digital Health Summit, with the participation of several speakers, national and international, with the objective to share experience in digital transformation, consolidate our health system in Madeira, In the transition period to the new hospital that will be certain in 2027, with less beds, more ambulatory, more robotization, more artificial intelligence, machine learning, and more database centers. We will have a third goal to evaluate the project candidates from our partnerships. Finally, I would like to emphasize the project of Madeira Digital Health and Wellbeing with the Institute of the New Technology, with 4 projects, supported by the European Commission starting in 2019. Smart Beds for all people and monitorization at home, Smart for Health Data Center for European data and the research of disease in all people, ICU for COVID for the ICU units, and the new approach, the patients through screening, very helpful in the COVID period, and the cold chain data for curriculum secure for the controlization in Madeira, with the amount of €1 million. And that's a comment that I think it is important to get to all of you and to the Data Forum Summit in this moment, sharing the new reality in Madeira, in digital transformation, in digital health, and data centers. The future in health system in Madeira will be digital. Thank you very much, and I hope these 2 days of conference and meetings will be very, very helpful for the future and for the digitalization in Europe. And because we are speaking in the health system, digitalization will be a good weapon for our systems. Thank you very much.
Thank you very much for this intervention. And last to intervene and close this closing session, Dr. Steve MacFeely, Director of Health and Analytics at WHO Global. It's a pleasure to have him here physically with us in Porto. Steve, over to you.
Thank you, Paul. Good afternoon. So, ladies and gentlemen, it's my great pleasure to give the last talk of the 2022 Health Data Forum. I'm sure it's a great relief for you as well. Yesterday, when I was planning my remarks, I was going to talk about data quality, and then somebody last night made a remark at the reception that made me change my mind. So I rewrote my comments this morning. At the end of 2023, we're hopefully coming out of a pandemic where in the first 2 years, excess mortality was almost 15 million people. Not all of those 15 million people died of COVID, but many died indirectly owing to the overwhelmed health services around the world. And were it not for the extraordinary kind of scientific developments and scientific progress made over recent decades, without the rapid development and rollout of vaccines, that death count could have been much, much higher. But the COVID-19 pandemic is not over. In October 22 alone, in other words, last month, over 50,000 COVID deaths were reported to WHO, and we await with trepidation the coming winter. But even though the pandemic is not over, the public health officials are already turning their attention to the future. COVID-19 has naturally provoked a desire to be better prepared for future emergencies. And this in turn has triggered a global pandemic preparedness program. In this age of quantification, the solution in the minds of many is to develop a dashboard or another set of indicators. But there's a saying among soldiers that generals always fight the last battle. And I worry that we're guilty of doing the same thing. By building dashboards, we're preparing to fight the last pandemic. We're preparing to fight the last health emergency. We don't know what the next health emergency will be, but we can be reasonably certain it's not what we expect today. We can be reasonably certain that it will surprise any dashboard that we construct. Now, dashboards and indicators can play a hugely important role in transmitting key messages. So my key point really is to consider the limitations. We should not put all of our faith in dashboards. I think that really is the road to ruin. Statistics play a dual role. They not only measure reality, but they also shape or define reality. A dashboard will measure reality, but it will also define it. As an aside, after the SDG indicators were selected, there was some quite heavy criticism that the SDG indicators were reductionist. And this struck me as a rather odd criticism at the time, as statistics are by definition reductionist. In fact, that's their purpose. Their purpose is to distill the complexities of life into a set of metrics that help us to understand patterns and associations. Thus, a dashboard may prepare us against future emergencies, but the risk is that they may also blinker us against unexpected emergencies. They may give us a false sense of security. If dashboards told us everything that we needed to know, we wouldn't have road accidents today. So we spent the last 3 days discussing data quality. We're all collectively concerned about data quality because we want to ensure that we're producing accurate research, good quality, robust statistical products. We understand that poor quality may lead to poor decisions and ultimately to poor outcomes. But in this age of measurement, in this age of quantification, where Drucker-esque phrases like what cannot be measured, cannot be managed, these are pronounced as self-evident truths, where anything that's unmetrified cannot be trusted. But anything that is quantified is regarded as empirical or objective. I also think we have a responsibility not only to think about the quality of our data, but also to think about how we convey the messages around that data. How do we convey uncertainty? How do we communicate the limitations of data and statistics so that decision makers understand that they cannot delegate their responsibilities to a dashboard? And my reflections lead me to conclude that there's no shortcut for analytical capacity. What we need to foster and encourage is creative analytical capacity. Before finishing, I'd like to give, I have one further reflection. When I began work as a statistician in the early 1990s, it was understood our mission was to provide information that would inform decision makers. And I stress the word inform. It was understood that decision makers would weigh the evidence, but they would take into consideration other factors, be they political, cultural, and so forth. So in other words, evidence was one part of a complex equation that leads to a decision. But since then, the phrase has morphed into data-driven decisions. To my mind, this is a completely different animal. Data-driven, to me at least, implies that data are making the decisions, not just informing them. Taking this to its logical conclusion, data-driven decision-making removes accountability from politics. After all, the politician has no choice because the data made the decision. And to an extent, this is true in what's happening today with artificial intelligence and machine learning. But I think this shift in language is noteworthy. And I think it's something we should pay more attention to. So I would like to conclude with a quote from one of my favorite books, a book called The Tyranny of Quantification by Jerry Muller. And he reminds us that measurement is not an alternative to judgment. Measurement demands judgment. Thank you.
Thank you. Thank you so much, Steve. We couldn't end that with a better note. And it was really a privilege for me to be a master of ceremonies of such an amazing summit. And it's really for me a career mark. Thank you so much, dear guest speakers, participants in the closing session for your interventions here and staying with us so late in the day. 18 hours of sessions in these two summits. I have also to express a gratitude to the tech support team that is being here and the ceiling of this auditorium supporting us, and also Ricardo and the team at IHD made this event so successful. We've been receiving so much good comments, and it's really a privilege and a pleasure to be here with you. Have a safe trip home, and once we're staying in Porto, I hope that the weather gets better for a better weekend. Thank you so much, Madeira, Dr. Pedro Ramos, Dr. Cerdas. Thank you so much, Dipak Karla.
Thank you.
Staying with us.
Thank you, Paul.
Thank you very much.
Thank you, Paul. It's been a real pleasure to work with you on this event.
Thank you and goodbye. May we close